Before a magnetic resonance imaging (MRI) scan, your doctor may prescribe gadobenate dimeglumine 529 mg/ml, 0.1 mol/0.2 ml, intravenous solution. This medication is a type of gadolinium-based contrast agent, GBCA, that helps the MRI scan produce clearer images, making it easier for your doctor to diagnose your condition. The optimal timing for taking this medication will be determined by your healthcare provider. Before starting this medication, it's important to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your healthcare professional. This medication is administered by injection into a vein by a healthcare provider, as directed by your doctor. The dosage will be determined based on your medical condition and weight. If you experience nausea, an unpleasant taste, or a headache, it may be a side effect of this medication. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people do not experience serious side effects while using this medication. However, if you notice any kidney problems, pain, swelling, or redness at the injection site, or swelling in your ankles or feet, be sure to inform your doctor. Seek medical help immediately if you experience dark patches on the skin, skin hardening, joint stiffness, hip or rib pain, muscle weakness, or difficulty moving. While serious allergic reactions to this drug are rare, it's important to seek medical help if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you experience any side effects, you should always consult your doctor for medical advice. This medication has the potential to cause kidney damage, especially in individuals with existing kidney issues, elderly individuals, and those with high blood pressure or diabetes. It is important for your doctor to assess your kidney function before prescribing this medication. Be sure to consult the side effects section for more information. Before using this intravenous solution, it's important to inform your healthcare provider if you have any allergies, especially to other gadolinium-based contrast agents. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have kidney disease, diabetes, or high blood pressure. After receiving this medication, gadolinium can remain in your body for months or even years. However, studies have not shown harmful effects from gadolinium if your kidneys are functioning normally. It's always best to talk to your doctor for more details. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used if clearly needed. It's important to weigh the risks and benefits with your doctor. This medication may pass into breast milk, but it is unlikely to harm a nursing infant. It's best to consult your doctor before breastfeeding to ensure the safety of your infant. When taking gadobenate dimeglumine 529 mg/ml, 0.1 mol/0.2 ml, intravenous solution, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. This is crucial for ensuring the safe and effective use of gadobenate dimeglumine 529 mg/ml, 0.1 mol/0.2 ml, intravenous solution. If someone has taken too much of gadobenate dimeglumine 529 mg/ml, 0.1 mol/0.2 ml, intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the best possible outcome. It is important not to share this medication with others. Before using this medication, you may need to undergo lab and/or medical tests, such as kidney function tests. It is important to keep all medical and lab appointments. It is best to consult your doctor for more details. This medication is administered once before your imaging test. It is used to help improve the visibility of certain body parts during the test. You won't find this medication at your local pharmacy. It is only administered in a hospital or clinic setting and is not meant to be stored at home. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.